I think that one of the most important findings in the last years in the Alzheimer's disease field has been the development of several blood biomarkers to detect Alzheimer's disease. And I think that in particular, the phospho-tau biomarkers are one of those that are more promising. However, I think that there are like two issues that need still to be addressed regarding blood phospho-tau biomarkers. The first of all is that most of the studies have been performing in research cohorts, so we need more data, more information in the real world, so in general hospitals, in primary care, in order to see whether these great results that we see in research cohorts also work so well in the general population, in a public hospitals, so in a more diverse population, in the real world. And the other issue is that now we have several blood phospho-tau biomarkers that seem to work very, very, very well. But what we need also is to do a kind of a head-to-head comparison of all these blood phospho-tau biomarkers in order to see, in order to assess whether that some of them perform better than the others. And actually, this is what we are doing in this study that we are presenting at AAIC in San Diego this year. What we did is to measure 9 plasma phospho-tau biomarkers and 9 CSF ones, and we did it in the patients of Hospital del Mar, which is a public hospital in Barcelona. And what we see is that many of these phospho-tau blood biomarkers, they are really good. They have a high accuracy in order to detect Alzheimer's disease pathology. And some of them, actually, they perform in a similar way as the CSF. So I think that we have very good news. So our data supports the idea that at least some of these blood phospho-tau biomarkers seem to work very well, not only in research course, but also in the real world, in a memory clinic, in the hospital. And now what we have to do is to try to work in order to implement these blood phospho-tau biomarkers in the clinical routine. I think that we have the example of the CSF biomarkers that it took a long time to implement them in the hospitals, and still in many hospitals around the world, they do not use routinely CSF biomarkers. It cannot take so long for blood biomarkers. We have excellent blood biomarkers, in particular the phospho-tau, and now we have to work in order to implement them to see if they work well in different populations all around the world, if they are influenced by different morbidities, if we have to test them in diverse populations. But we really need to work to implement these blood phospho-tau biomarkers.